Hi, my name is Mazen Kashif, and for my capstone project, my whole topic revolved around psychiatry. I want to know how assisting a psychiatrist can teach about the struggles and the job of working in psychiatry. I'm very happy that I chose this topic because psychiatry is a career I've always admired and wanted to pursue. The most I hoped to gain from this project was information that would help me get into the job. However, I was able to gain something even better. I was able to build meaningful relationships with the people I worked with and also the patients that I helped. During this project, my mentors were able to help me understand the mental state of each patient by observing their behavior, understanding the problems, and also knowing how their day to day life was like as well. In addition, I was taught how to treat each patient's mental health problem that they were struggling with as well. And lastly, I was also able to learn the effects COVID-19, the coronavirus, had on people's mental health. So here I have my project laid out in a poster board, very organized and neat.
So for my capstone project, my topic question was how can assisting a psychiatrist teach you about the struggles and the job of working in psychiatry? I separated my project into several categories listed in the table of contents. Firstly, how to get into psychiatry. While you're in high school, study the prerequisite courses to enter a university science program. Choose courses mainly in physics, chemistry, biology, and math. Also, participate in extracurricular activities such as volunteering or playing sports. Bachelor's degree. Enroll in a 4-year undergraduate or bachelor's degree university program in science. Some medical schools don't require an undergraduate bachelor's degree. Medical school. Take the MCAT, but it may be optional depending on the school. Next, apply to more than one. This process may require reference letters and series of interviews. Once you're in medical school, attend the medical school for 4 to 6 years to obtain your MD. Postgraduate residency. Apply for postgraduate residency in your final year of medical school. You must obtain postgraduate education certification before applying. Practice as a psychiatric resident for 5 years, trained in diagnosis, psychopharmacology, mental health, and etc. Final steps in certification: you must pass the examination and fulfill requirements to obtain your medical psychiatric certification. So, what is the job of a psychiatrist? Psychiatrists evaluate, diagnose, and treat patients with mental, emotional, and behavioral disorders. They conduct thorough psychiatric evaluations and develop treatment plans with their therapists. If medications are needed, they will contact the pharmacy to release the medication required, and after a period of time, psychiatrists follow up with the same patient and evaluate the treatment results, and may provide a new one if their condition isn't improved. So, the benefits of working in psychiatry: your work allows you to help someone with mental health issues, traumatic experiences, or substance use issues every day. You basically change people's lives. This work also gives you enough free time to devote to your family and friends, unlike other professions such as surgeons and anesthesiologists. The work also provides psychiatrists with a high level of financial stability, between $500,000 and $200,000 annually. They can also be self-employed by opening their own private clinics. We've talked about the benefits, but what about the struggles? Psychiatry is a highly stressful career option to consider. You work 6 to 8 hours per day in appointments, and there's hours of paperwork involved. Your work requires you to listen to others as they express their frustrations and problems. There also have been high levels of burnout in this profession. There's also been physical dangers to consider, as some patients may have questionable states of mind at times and can attack the doctors. It can also be challenging to develop an accurate diagnosis and correct treatment plan for each patient. So, what are the regular problems of patients? Through many of the experiences I saw with many patients, there was a recurrence of similar issues they all had. They tend to stay in their rooms all day and avoid eating. They develop eating disorders and become fatigued. They have mood disorders and become depressed. They have bipolar disorder and they also have anxiety. This can affect their focus at school and home very differently. Some also have psychotic disorders such as schizophrenia, and some can have trauma related disorders such as PTSD. In schools, patients feel more at ease and more mentally stable due to spending time with friends. However, lack of social interactions results in more suicidal thoughts. The treatment of patients. The treatment of mental health is based off a model called the biopsychosocial model. It is a model that states that interactions between biological, psychological, and social factors determine the cause and outcome of wellness and disease. It is delivered through multidisciplinary themes. Different people have different roles. Activities such as long walks, board games, or sports can help patients become more stabilized. Engaging with youth workers can also help build social confidence. Patients can also be involved with community and acute services, and sometimes patients will be prescribed medication. So we talked about community and acute services, but what are they? Community services are outgoing hospital clinics, such as the START program, crisis intervention program that anyone can contact and runs 7 days a week. It provides successions for short-term support and given help from psychiatrists. It usually comes from a referral from the community and the hospital. Psychiatrists assess patients and provide medication. After the START program, they are connected with other counseling supports, many child and youth mental health services. Another outgoing hospital clinic is telehealth. Patients can connect with health workers to ensure individual continues to get help. Community services provide support for individuals with mental health for a longer period until they achieve stability to cope themselves. Acute services. Acute services involve hospitals, the ER, and inpatient units. Hospitals are open 24/7 for emergencies who get worse and can't be treated through outpatient clinics and are not safe in the community. Clients are given separate rooms from other patients, and the hospital provides assessment and intervention. Therefore, once they're stable, they are discharged. Psychiatrists conduct surveys to observe the change in the mental health status of different patients over a monthly period to determine whether or not they're getting the right treatment. And in this case, I conducted an experiment as well to check if the condition of patients had improved after a 2 month period from the treatment they were receiving. So patient 1, 2, 3, and 5, their conditions had all improved. However, patient 4 and 6 did not improve. Therefore, they would have to get a different treatment plan. So the effects of COVID-19. Many places are temporarily shut down, such as schools, restaurants, malls, and etc., and people are restricted to their homes. COVID-19 has elevated rates of anxiety and stress. Due to being quarantined, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior have risen. Direct face-to-face mental health teams have also stopped, and this is important for vulnerable individuals. Mental health teams have used video conferencing as a more effective way of connecting with patients. Patients with very severe mental health conditions will be allowed to be brought into hospitals, and in hospitals, all doctors are required to wear protective gear at all times. So here is a graph with information provided from the psychiatric clinic. So it shows that the number of patients per month. And in January, when COVID was first gaining media attention, many people were very anxious about it. Therefore, there were a little high number of patients during that month. However, from February to March, that number had slowly died down. However, once COVID had came into Canada and lockdown was inflicted on us, people have become very stressed, which has led to the spike in the graph here. But now that restrictions are being lifted off in May, there have been less patients coming now. How is psychiatry portrayed in the media? Studies consistently show that entertainment media provide overwhelmingly dramatic, negative, and distorted images of mental illness. They emphasize that patients are dangerous, unpredictable, and also have criminal-like minds, and patients are sent to asylums and forced to wear straitjackets to control their behavior. They also show that treatment that psychiatrists offer are harmful punishments that are done without consent. For people who have mental illnesses, this negative media portrayal has had severe consequences. It impairs their self-esteem, help-seeking behaviors, medication adherence, and their overall recovery. Psychiatrists blame the media for promoting the stigma and discrimination toward people with mental illnesses. Only a small percentage of people that have the serious mental disorders that you see in the media actually exist. So here we have two examples of movies, pictures from movie scenes where mental health is being portrayed in. So over here on the left is Joker and on the right is Split. So both of these characters are psychotic killers, and they show that these people with mental health problems are also crazy. So in conclusion, as with most medical professions, working as a psychiatrist requires a specific mindset that some people have and others do not. Your ability to diagnose and treat the health conditions of patients comes from a robust ability to listen. You have to show compassion to those who struggle with substance abuse, anxiety, or depression, and there are many benefits to this job, such as a high salary and a balance between your work and life. I enjoy the idea of working in a mental health career as I love helping others and would like to pursue this as a passion one day in my life. Thank you. This has been my Capstone project.